Hello, I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I am Denzel Washington, 70 years.
Nice to meet you. How can I advise you?
Well, you can call me Denzel.
Okay, Mr. Renzel, I have got a letter from your GP saying that you have low back pain for last couple of months. Is it right?
Yes, doctor. It's right.
So I am going to talk about your issue, and during our conversation, I may take some note, but all the information will be remain confidential. So is that okay for you?
Yes, doctor.
So can you please tell me in your own word what is happening with you?
Uh, well, doctor, actually, for the last few months, I think for the last 3 or 4 months, actually, I felt that I have been suffering from back pain. It's actually, I think it's in the lower back, this pain. And at the beginning, I didn't care so much, but as the day progressed, I think that the pain actually gradually increased. And because of that, I went to GP, and my GP prescribed me some painkiller, I think ibuprofen. But at the very beginning, it helped a bit. But as the day has gone by, I don't think that it's helping me much. And so I went to my GP again, and he did some blood tests. And in that test, actually, it was found out that I have some problem with my blood. Okay, I have less amount of blood. So, and some urine test also. So finding these things, the GP referred me here, and he told me that there might be something bad. So I am here to the doctor to find out what's happening with me.
I'm sorry to hear that. And can you tell me that when you first noticed the pain?
I think, doctor, it's around 4 months back.
Okay. And can you show me the exact site where do you feel the pain?
I think it's just in the lower back. And how can I show you? No,
Okay,
I think
it's
it's
in the middle or on one side.
in the middle, doctor, in the middle.
Okay. And you said it started gradually, but it is increasing in severity progressively.
Yes, doctor.
How frequently do you feel the pain?
Now, doctor, I feel it quite frequently. Whenever I do some work, I think I get this pain. So now I'm irritated, doctor. It's quite frequent now. I think it's almost every day I feel the pain.
And have you noticed that uh, does this pain go anywhere?
No, doctor, this doesn't go anywhere else.
And how will you feel the pain? How will you describe the feeling of your pain?
I think, doctor, it's quite dull aching pain.
And along with your pain, have you noticed anything that is any presence of morning jamming?
Doctor, there is some jamming, but I think it goes away within 10 to 15 minutes.
Okay. And have you noticed that if you have any weakness on your side,
No.
on your legs?
Doctors, recently for the last 1 or 2 months, I think that gradually I'm feeling some weakness in my legs. Some weakness, some heaviness in both legs.
And have you noticed any swelling over your pain area?
No, doctor.
Any warmth over the area?
No,
Any redness?
I haven't noticed.
Did you get any injury or trauma to the area before onset of your pain?
No, no, doctor.
Have you noticed any changes in your water work?
Doctor, actually, it's not new. Okay, so it's actually I have a problem in my water work for the last around 15 years. I have some problem in my water flow. Okay, at times there is some dribbling, and I have to go at times more frequently because I don't feel satisfied after doing my water work. So it's nothing new, doctor. And I think that that's the problem is almost the same.
And can you tell me that have you ever taken any medical attention for that?
Doctor, actually, I think it's been quite a long time since I took medical attention. I think the last time I visited the water doctor around 2 years back, and he told me that I might be suffering from some issues with my prostate. But he told me that it was nothing serious, so he gave me some medication, I think, and I took them, and later on I didn't go to any follow up.
Okay. And can you tell me that have you ever noticed any blood or any change of your color of your water work?
I haven't specifically noticed, doctor, but I think once or twice in the last 2 or 3 years, I think I thought that there was some redness, once or twice episodes, but I'm not sure.
And have you noticed any pain over your around your back passages or around your male parts?
No, doctor.
How frequently you have to pass your water at night?
2 to 3 times, doctor, usually.
Okay. And have you you told that you feel uh, uh, that is you cannot empty your you cannot pass
Yeah,
your water
yeah,
fully.
yeah.
Have you ever noticed any changes in noticed any burning pain or any pain during your water work?
No, doctor, no.
Any rash,
No,
any swelling over the area or any around in the area?
no, doctor, I haven't noticed.
And what about your bowel habit?
So I think it's quite okay.
And you said that you have some heaviness on your legs. For how long?
Yes. I think it's last for the 1.5 months, doctor.
Have you noticed any weakness? That is, you cannot walk properly or you feel pain when
No,
you walk.
not that much weakness, just a bit weakness, but I can do my regular activities yet now.
And any changes in the sensation over your legs?
I think the doctor some changes. I think I'm not totally sure, but at times I think that there are some pain or some just some pins and needle type of sensation in my legs. Sometimes both legs, I think.
All over and any numbness?
I'm not sure about numbness, but I think some pins and needles. That's for sure. Numbness might be, but I haven't checked it.
Okay. I'm going to ask you a few more questions. That do you have any headache?
No,
Any generalized weakness or any excessive lethargy?
I told you, doctor, that I feel a bit weak now. As the day is progressing, I feel that I feel pain in my back whenever I want to do work, and that's causing some weakness, some irritation.
Do you have any rash anywhere in your body?
No,
Any changes in your vision?
no.
How about your appetite?
Uh, I think, doctor, I think I'm getting old, and I am also getting some loss in appetite. I don't enjoy eating food that much now. I think my appetite is coming down, going down.
And have you noticed any changes in your weight?
Yes, doctor, that's another issue. I think for the last 2 or 3 months, I think I have been losing some weight, and I think I have lost around 4 to 5 kgs of weight in the last 2 to 3 months.
Do you have any hot or cold preferences or any weather preferences?
No,
Any cough?
no, doctor.
Any shortness of breath?
No, doctor.
Any chest pain?
No,
Any racing or pacing of your heart?
no.
And about your pain on your back, can you tell me that how severe is the pain? If you tell it that your pain is from one is where is one is less and 10 is the highest, how will you score it?
I think that it's around 4 to 5, doctor.
Do you feel any night pain or does it hamper your sleep?
Yes, doctor. Yes. First of all, that was my water work issue that caused harm in my sleep, and now this pain also, I think. at times causes problem.
Have you noticed anything that makes your pain worse or better?
I think when I take some rest, it's a bit better now.
Okay. Do you have any past medical condition that you would like to share?
No, doctor, no past medical condition. Well, one thing that I have, so I had some high blood pressure issues, and I took some, I think, some Ramipril for that, and it's been well under control.
Okay, that is fine. And except Ramipril, do you take any other medication?
No, doctor.
Any over-the-counter medication?
No,
Any herbal products?
no,
Do you have any allergy to any medication?
no, doctor.
Any of your family member have this type of condition?
No, not that I know of.
Any history of cancer in the bowel or prostate in your family?
No.
May I ask you a few more personal questions?
Yes.
Do you smoke cigarette?
Yes, doctor.
How many sticks and for how long?
Previously, I ate a lot more. I had a lot more, but now for the last 10 years, I think I have reduced it to 2 to 3 sticks per day.
Okay, and I think your condition is also related to this, and also it is smoking is injurious to health. So I will recommend you stop smoking totally. And if you need help, I can refer you to the smoking cessation clinic. Is that okay for you?
Okay, doctor.
May I know that do you drink alcohol?
No,
That is fine. And may I know that what do you do for a living?
now I'm a retired person, doctor.
And previously, what did you do? Any history of exposure to any chemicals or any chemical factory?
No,
Okay. And may I know that whom do you live with?
I live with my wife, doctor.
And are they well supportive? Doing
Yes, doctor.
family?
Yes.
Okay, that is fine. Do you have any history of recent travel?
No,
Do you have any fever or night sweats?
I think I have some raised temperature recently at times for the last 1 or 2 year, 2 months.
Okay. And may I know that what is your concern?
I think that well, I'm losing weight and this pain it doesn't go away. And the GP told me that I might be having some bad cause behind this. So what is it?
As I have taken your history, I need to examine you to give the better explanation. But as I have taken your history, a few possibilities come to my mind, and one is that your might have some problem with your prostate, and there is possibility that you might be suffering from cancer in the prostate. But we need to examine you, and we need to run some tests before being sure that. And sometimes this type of cancer can goes to the bone, so have this pain. There are also some other possibilities of having this bone pain, like having some fracture, having some cancer in the bone. And one private thing I need to ask, if you don't mind. Can you remember,
Yeah.
can you tell me that have you had any problem in your male power before?
No, doctor, I haven't noticed.
Okay. So now we need to run some blood test, some test of your water work, and some imaging test of your tummy and also your back. And after that, we will be able to give you the best answer that what is happening with you.
Okay, doctor.
I'm
Well, okay. Well, do I need admission?
uh, this condition we can manage it on outpatient basis, but we will manage it urgently. We will do all this tests on urgent basis.
Okay. So okay, thank you. So, what's your diagnosis here?
For this gentleman, my probable diagnosis is this is a case of secondary bone metastasis, probably from the carcinoma of the prostate. My other differentials are it can be a case of multiple myeloma and also primaries of bone carcinoma, or can be due to from any osteoporotic fracture.
Okay, that's all right. So actually, I have just one question. You have done very well. Do you have you excluded all other causes of of this bone pain? Or do you think?
Uh,
Okay, I think it's all right. No issues. And well, how will you investigate the patient?
I'll go for the baseline routine investigations to see complete blood count to see anemia and white blood cell count level, then inflammatory marker CSR and CRP. And after that,
Okay.
liver function test, renal function test, urine for routine examination, and urine for Benson's protein. And also,
Mm,
we'll go for the serum calcium level, serum parathyroid hormone level, and serum phosphate level, and serum
mm,
alkaline phosphatase level. Then I will go
mm,
for the ultrasonogram of the prostate.
mm,
Then I will go for the X-ray of the lumbosacral spine and also MRI of the lumbosacral spine. Then I will go
mm.
for the bone scanning. I may go for the
Okay.
biopsy of the prostate.
Yeah, and do you need to do BMD, bone mineral density?
Uh, if this after coming these results, if they are suggestive of taking bone mineral density, then I will go for that. I will not go for primary.
Yes. So, what is the management for this patient?
That is multidisciplinary approach. That is, I may need to involve the I may need to involve the urologist, then then oncologist team, and after that they will be able to review him and give the best management for his further management.
Okay, and well, another thing I would like to ask that did you want to do prostate specific antigen test?
Yes, I forgot to mention that I go for the prostate.
Yes. So, how can be the management in this patient? For can you tell any specific one, or just do you do you think that you yourself can manage this? You told that it can be managed as an
Yes,
outpatient
it
basis.
is a multidisciplinary. It is a multidisciplinary approach, but the management options are for medical managements like 5-alpha reductase inhibitors.
Hmm.
Then going for continuous noradrenaline releasing hormone. Uh,
Hmm.
then another option like going for any surgery of the prostate and
Yes.
so or any
So, what is now the most common surgery done?
so I think the surgery for the prostate cancer is transurethral resection of prostate.
Okay, so once this surgery is done, can you think that you have to be aware of something else?
Okay, after surgery, there is also chance of retention of urine.
Yes, okay. Actually, there can be some new construction of bladder. So, I think electrolyte imbalance can be present after TARP surgery. So, I think that can be an important issue for patient management. Okay, that's actually not too much related here, and I think you have done really well. And I think most other issues have been covered. And so, actually, since it's a mechanical, I think more. So you have excluded malignancies. You have also excluded infectious causes. But I think for infectious causes, I think TB, brucellosis, these are important. And for brucellosis, you could have asked to whether any exposure to rural spaces or sheeps or something like that. But it's all right. And again, I think since he has been an old patient, I think any IV drug exposure, not maybe for recreational use, but for hospital admission or some skin condition or IV drug abuse, sometimes this can also cause some problem. I think chronic osteomyelitis or something like that. And the others, I think you have more or less covered. For osteoporosis, you have actually covered all the risk factors like thyrotoxicosis. You asked about medications like steroids. So I think this has been good. Okay. So do you yourself want to add anything?
One thing I want to add, because I was when asking going for the pain, I was somewhat I forgot to go systematically. That is for Socrates. Then after taking
Yeah,
all
yeah,
the history, I
I remember
remember
that.
that yes, I need to go for the Socrates. Then I went
Yeah,
back
yeah, yeah, yeah. You actually just went a bit haphazard, specifically when I talked about water work, because I think you didn't expect that I would have told that at that moment, because you were going quite systematically. But when I told about that water work issues, I think
okay.
that created some problem that then you
Yeah,
actually shifted
I should
to.
come for the associated symptoms uh, elaboration just somewhat later, but I went for that very
Yeah,
early.
yeah, and because of that, I told about the posted symptoms, and that actually jeopardized you. I think then you
No,
got a bit haphazard. I think.
that wasn't main issue. Main issue was that I was somewhat mentally disoriented. Okay.
Okay, okay. Yeah, yeah, yeah. That's all right. That's all right. It's a very beautifully